is a fact of life, but looking your age certainly is not. You do not have to accept that certain parts of your face will sag or wrinkle. Instead, you just give it a little boost while still looking like you. The beauty coach, Dr. Therese Stubbs, has all the tricks and, more importantly, the skills to keep you looking your best. Dr. Ann, thanks for being here.
Thanks for having me.
So I know a lot of people kind of obsess about wrinkles, but that's not really the only thing that happens to our face as we get older, is it?
It is not. We lose a lot of volume in our face, and people don't always realize that we lose the fat in our face, and the fat and the volume is what makes us look youthful.
Fat is good.
It is good in your face. It is.
So how does volumizing the face with dermal fillers kind of compare to having a traditional facelift?
So a facelift is just tenting the skin back up. So it can look a little unnatural sometimes,
right,
and it just looks like the skin is pulled tight. And what really you need is not only the skin tightened, you need the volume back to lift the cheeks up, lift the sides up, to basically restore what you had 10 years ago.
So what are some of the advantages to doing the facial fillers?
The facial fillers, we kind of call it a liquid facelift. We can put fillers in multiple different places. Some ladies hollow in their temples. A lot of it, the complaint that I hear is, I'm getting these jowls. This is all coming downward. And that really is a loss of volume here, back here, and right in the fat pad right here. So by putting some of the fillers back here and also in the chin, we can lift that back up where it belongs. And it creates a natural look, because that's what you looked like 10 years ago or 10, 15 years ago. So oftentimes I'll have ladies bring in a picture of what they looked like. They say, remember when I looked like this? And we can restore that. Yeah, we can restore that with a lot of the fillers that are very safe, very effective, and can build your own collagen around them.
And one place that works extremely well, which you mentioned, is around the eyes. So we're going to take a look at one of the befores, and then we'll see the after, and just how well this liquid facelift really dramatically changes somebody's appearance.
So right under the eyes, we all hollow in kind of our mid-face, and we get the kind of, people call it a dark circle, but really you're hollowing around the bony rim, the orbital rim of the eye. So we can float some filler right down in there along the bone where those red arrows are, and then you can see in the next picture she doesn't have the crease there.
Let's look at the cheeks next, because this can also help here.
Exactly. In the first picture on the left, you can see she's kind of looking a little bit tired because she's lost a little volume in the mid or the apple part of the cheek there and right under the eye. So where the red arrows were, we put some filler right along the orbital rim or the bony rim by the eye, and then we put some down lower in the cheek too, and in the little nasolabial fold right by the nose. And so in the after picture, you can kind of see that gives her a whole lift of the whole side of it softens her look, and it gives her back the volume so she doesn't look quite as tired.
Now, when you talk about dermal fillers, you name a few different names. How are they different? Are they all the same? How does somebody know what they need?
And that's a really tough one, because a lot of the companies are now doing the kind of direct-to-consumer marketing, and so you'll hear words like Juvederm, Juvederm Ultra Plus, Restylane, Restylane Lift, Restylane Silk, and people don't know exactly which ones they need, but they're basically different thicknesses, to put it as basically as I can. They're all hyaluronic acids. All those fillers that I just mentioned are very natural products. They're hyaluronic acids that are already in our skin. They're made to be exactly like ours, so they plump the skin and become integrated in the skin and feel very natural. They do go away in about a year to 2 years, depending on the thickness. So when people come in, we'll kind of look at what their concerns are, see if we need to kind of build structure back. So I say sometimes, like, the Restylane Lift is like scaffolding. We're putting that underneath to kind of prop the face back up, and then the Silk is this tiny little, it's like fine lines. It's like a little paintbrush. It's great to get away with little, and people might have a scar from a fall, from an acne, incident years ago, and we can put the Silk in that as well.
All right, Dr. Ann, quickly, I want to mention the deal, the most important part here, if people want to come in.
That's right, and so we always do a complimentary consultation, because people don't always know what they need. We like to talk about what your concerns are and what we can do for them, and normally the fillers are anywhere from $600 to $900 a syringe, and so everything for daytime use is going to be $4.99 a syringe for facial filler.
All right, perfect, Dr. Ann. I want to thank you as always for being here.
Thanks for having me.